Hi everyone, my name is Mia and today we are going to look at equity in health. Thank you so much for joining. So first we have a critical question. Why do inequities exist in the health of Australians? So speaking about Australia, it often does relate to other countries as well. But factors that do create these health inequities are daily living conditions. So how a person lives significantly influences their health. Like living conditions include the necessities of life. The basic needs are shelter, food, and clean water. Other basic needs are peace, sanitation, education, and of course, healthcare. The quality of early years of life are really important. The issues that impact the quality of the early years of life include pregnancy. What the mother does during pregnancy is really important. Alcohol can develop into fetal alcohol syndrome, which essentially means that the eyes are more apart, their brain development is a little bit slower, and you really can notice it. Also, what kind of nutrition is really important. Any drug use can also really affect the child's development. Birth weight. So a low birth weight can result in a chance of poor health. Breastfeeding, of course, has all the nutrients and nourishment that a baby needs, and there are many benefits associated with breastfeeding. In early years, any respiratory diseases can affect a child, such as asthma, and it is more prevalent in Aboriginals and Torres Strait Islanders. Injuries and poisoning, well, this is a real big one. These are the leading causes of death and morbidity for young children. Poisons up high, any cleaning products up high. Vaccinations, well, immunization provides opportunities for maintaining good health during the early years. And then, of course, we have passive smoking. So there are health risks associated with passive smoking. That means you're not the person actually doing the smoking, you're actually inhaling. Aboriginal and Torres Strait Islander and, of course, low socioeconomic status groups tend to have higher rates of smoking. So years of life, basic needs being shelter, food, and clean water. And things that affect inequities in health are from pregnancy, birth weight, breastfeeding, respiratory disease, injuries and poisoning. We should also include drownings, vaccination, and thank you for everyone joining. Access to service and transport. So these will vary across country. Remote and rural areas have fewer GPs, but now that we have telehealth, we have it more accessible with the World Wide Web. And also sometimes we need to see dentists and or other healthcare professionals, and they're not always prevalent in rural areas. So sometimes people have to travel hundreds of kilometers to access. Can also be a factor, and not only in relation to distance. Low socioeconomic status groups and the elderly can have difficulty accessing the necessary transport, as well as those that are disabled. And this impacts the equity of our Australians. Socioeconomic factors. Well, you've heard the saying, money can't buy happiness, health status. Financial opportunities, social opportunities available to people with a financially healthy disposable income makes a big difference. The reason is you can buy piano lessons, dance lessons, sporting, and numerous things if you have that disposable income. And if you don't, it makes it a lot harder to have these social and financial opportunities that relate to your health, such as education, employment, and income. Discrimination can lead to health inequities. Those who do not feel connected to any social groups tend to engage in antisocial behavior, such as binge drinking, smoking, tobacco use, illicit drugs. Also, taking driving dangerously, and sexual habits. Government policies are really important, where they're responsible for setting health policies and education. Education is clearly linked to health standards and employment opportunities. Governments tend to make decisions to suit the wider population, area, or community, and these decisions do not always meet everyone within the community. Okay, so now we've gone through health and equity in Australia specifically, looking at daily living conditions, having those stable shelter, food, clean drinking water, and access to education. They make a big difference. Access to services such as allied health professionals or GPs, but also, and doctors and dentists, and also looking at accessibility to services with transport. Sometimes public transport isn't the easiest for those that are disabled or elderly. And of course, socioeconomic factors, community and social attributes, and government policies and priorities. Now we're looking at what inequities are experienced by public in Australia. So, Aboriginal and Torres Strait Islanders, there's epidemiology in areas of inequity that overall the statistics of Indigenous Australians indicate significantly worse health than non-Indigenous Australians. Also, well, topic Pacific Islanders, the gap is huge. A greater number of Aboriginal and Torres Strait Islanders have more challenging upbringings and disadvantages during their early years, like low birth weight and numeracy and literacy difficulties, decreased household incomes as well. Life expectancy, oh my gosh, guys, it is 17 years less than non-Indigenous Australians. For example, at the moment, males live at life expectancy is 59 and female 65. Infant mortality rates, that's like, what is a rate of death for kids? Well, it's 3 at 14 high. Increased geographical isolation correlates with increased mortality rates. So when we are isolated geographically, it also increases death rates. Mortality rates are higher for almost all causes of injury, illness, and disease, and they account for a higher proportion of Australia's total disease burden than the actual proportion of Indigenous Australians. And of course, there's an increased rate of hospitalisation. So you can see that it affects mortality rates, life expectancy, okay. What are health determinants? Well, health determinants are individual, socio-cultural, and socio-economic environment. But really, I want to talk about the role of media, such as TikTok, Facebook, YouTube, Instagram, Reddit. Despite the poor standards of health and living conditions, media must also report on the accomplishments of the Indigenous Australian community, as well as other population groups. So those that are disabled, those that are elderly, those that are maternal or like pregnant. It's really important to not just do one group, but everybody, because we are a community, we are Australian. And sporting, cultural, and educational success is really important. It alters people's perceptions, particularly for those that need it the most. And it provides role models and a sense of pride. Therefore, we should populate healthy messages across the globe with inspirational role models. It's significant for our health. And that's all for today. I'm so grateful that you guys have joined. What a great educational workshop. This is part of the HSC Personal Development and Health. by Cambridge, published by Cambridge, and it's pretty important. We're up to page 126, which so happens to be my favorite number. Thanks for joining. I'm Mia.